Columbus Regional in the last year, we've really been focused on elevating quality and service throughout the organization. I think Columbus Regional Healthcare System has always served as a very strong provider of healthcare services, but we really feel a need to elevate that to the next level. We've implemented some new programs, a hospitalist program, so that patients that are in the hospital can have access to their physician on a day-to-day basis much more easily than sometimes community physicians who also have office responsibilities can provide. We are putting in some new service initiatives throughout the hospital that I think will make it a higher touch facility, and really hearing some great things back from the community on that. The hospitalist programs really serve a growing role in hospitals across the country. As community physicians in all communities find it tougher and tougher to get out of their office and into the hospital on a timely manner, and kind of the tradition has been that physicians in private practice will come in and round on patients very early in the morning or late in the evening before or after office hours. A hospitalist program can do their rounds during more traditional hours. They're really dedicated to being in a hospital and don't have a traditional office practice. So accessibility and availability tends to be higher with hospitalist programs. I think secondarily, hospitalists really only serve acute patients in hospitals, and so they're dealing with those acute issues on a day-to-day basis. Our community physicians are tremendous practitioners here. We're really blessed with a strong medical staff, but like lots of more rural areas, Columbus County is underserved medically, and so to the extent we can add services in the hospital, and I think it's a big advantage for patients. We've also heard it's a big advantage for patients of community docs that refer to the hospitalist program, because those doctors less frequently get called into the hospital and out of their office. So patients will typically see their docs faster in their offices, have fewer call-outs and emergencies, and should have a little more planability, particularly with family and visitors in the hospital. They'll know when their doctor is going to come and see them. We have provide outpatient imaging and outpatient lab work that is all Joint Commission accredited and of the highest quality. We have a tremendous staff of radiologists, a wonderful pathologist. We have some great hospital-based physicians, but like most hospitals, can be challenging to get into the hospital to have outpatient services done. So we're looking at some facility upgrades as well as changing our processes to make it more convenient and accessible for patients in the community, so that they know they're able to get both the high quality services that a hospital can provide, but in a convenient setting that sometimes outpatient facilities can provide on a better level. We are in the midst of real transformation within the emergency department, and working to reduce wait times and improve turnaround times, and both getting folks that don't need hospitalization treated and back home where they can get well sooner, but also when they do need acute care services up into their beds quicker. So we're excited about the direction the hospital is going. We see lots of positive trends there, and really are excited about having this be a place that citizens in Columbus County are not just pleased, but thrilled to call their local health care provider.